Today we're going to go over some distal limb bandaging techniques for when your veterinarian tells you that you need to apply a bandage to your horse's limb. The materials that we have here are some of the common materials that we are going to use. A telfa pad, which is a non-adherent dressing to go directly over the wound, gauze or cast padding, sheet cotton or pre-made ready rolls, brown gauze, vet wrap, and elasticon.
This is the type of bandage that we would use to cover a wound or cover a surgical site. And for the purpose of this demonstration, we're going to pretend that our wound or surgical site is over our fetlock.
First, you start with the non-adherent telfa pad and the clean gauze. Open the telfa pad, making sure that you only touch the corners so that you don't contaminate any of the material that's going to go directly over the wound. Then, while still touching only the corners, roll the clean gauze on the back side of the telfa pad. Once they are together, place them over the wound or the incision. Use the telfa pad to cover the wound directly and the gauze on the back to wrap around the limb. You want to wrap above and below the site with the gauze or the cast padding. Use enough tension with the gauze or cast padding so that it stays in place, but don't wrap it too tightly. Once you finish wrapping, tuck the end of the gauze in place so that it stays. Next, it's time for the compression layer. We're using a pre-made ready roll for this layer. I find that it's easiest to start with the cotton on the inside of the leg. Once it's secured in place, begin to wrap around the limb. Apply nice and even pressure and tuck in the corners as you go. Put pressure across the cannon bone and ride that pressure around the back of the limb over the soft tissues to keep it snug and in place. Next, you're going to secure the ready roll in place with brown gauze. Start by placing the brown gauze on the inside of the end of the ready roll. Tuck it in and holding in place, then begin wrapping the gauze around the limb. You're going to want to leave about an inch of your cotton roll exposed to the top. As you wrap, pull snugly across the front of the cannon bone as you go. The goal here is to compress the cotton evenly all the way around. Overlap the brown gauze by about 50% with each roll as you go down the limb. Again, leave an inch of cotton exposed at the bottom of the wrap, and then begin wrapping back up the limb until you reach the end of the roll. The next layer is going to be vet wrap. The vet wrap is an additional layer of compression that's more elastic than the brown gauze. You're going to apply this in a similar manner to the gauze, but as you apply tension, you will stretch out the crimp of the material as you wrap. Begin wrapping over the gauze. Similarly, put most of the tension across the front of the cannon bone and ride that tension around the back over the soft tissues of the limb. Go to the bottom, still leaving an inch of cotton exposed, and head back up. When you finish your wrap, stick it down to itself. Finally, we want to be sure that the wound or surgical site is safe from contamination by securing the top and the bottom of the bandage with elasticon. Place the elasticon on the skin with minimal tension, and as you pull the material over the bandage, you can use more tension over the underlying padded layers. The top is now sealed, and we will do the same for the bottom, starting at the hoof and wrapping up. The bandage is now secure. This is just one example of how to place a bandage to manage a post-operative surgical site or a wound on the distal limb of a horse. There are many different materials you can use, and slight variations of this technique can be employed. If you have any further questions, we encourage you to seek the advice of your horse's primary care veterinarian.